What to do when the child does not like going to the doctor. Many children do not like going to the doctor, and there are several reasons why this may be the case. Here are some of the most common reasons why children may not like going to the doctor. Fear. Children may be afraid of going to the doctor because they associate it with pain, needles, or uncomfortable procedures. They may also be afraid of the unknown, especially if they have not been to the doctor before. Lack of control. Going to the doctor can be a stressful experience for children because they may feel like they have no control over what is happening to them. They may feel like they are being poked and prodded without any say in the matter. Anxiety. Children who suffer from anxiety or have had negative experiences at the doctor in the past may be more likely to have a negative attitude towards going to the doctor. Separation anxiety. Young children may experience separation anxiety when they are away from their parents, which can make going to the doctor a difficult experience. Busy schedules. Children who are busy with school, extracurricular activities, and other commitments may not want to take time out of their schedule to go to the doctor. To help children feel more comfortable with going to the doctor, parents and caregivers can take several steps. These include talking to your child. Explain to your child why it is important to go to the doctor and what to expect during the visit. Answer any questions they may have and be honest about what will happen. Role-playing. Role-playing doctor visits with your child can help them become more familiar with what to expect. You can use a toy doctor's kit to show them what the doctor may do during the visit. Offering choices. Giving your child choices, such as which toy to bring or which color bandage to use, can help them feel like they have more control over the situation. Distraction. Providing your child with distractions, such as a favorite toy or book, can help them take their mind off of the visit. Positive reinforcement. Praising your child for their bravery and offering rewards, such as a special treat or activity, can help motivate them to go to the doctor. Building trust. Building a trusting relationship with your child's doctor can help your child feel more comfortable during visits. Encourage your child to ask questions and express any concerns they may have. Reducing anxiety. If your child suffers from anxiety, it may be helpful to use relaxation techniques, such as deep breathing or visualization, to help them feel more calm. Scheduling appointments at convenient times. Try to schedule appointments at times that are convenient for your child's schedule, such as after school or on weekends. In conclusion, there are many reasons why children may not like going to the doctor, but there are also many strategies that parents and caregivers can use to help them feel more comfortable. By talking to your child, offering choices, providing distractions, offering positive reinforcement, building trust, reducing anxiety, and scheduling appointments at convenient times, parents and caregivers can help their child develop a more positive attitude towards going to the doctor. It's important to remember that every child is unique, and what works for one child may not work for another. By being patient, supportive, and flexible, parents and caregivers can help their child overcome any fears or anxieties they may have and develop a positive attitude towards their health and well-being. Many children are anxious or unhappy about going to the doctor for checkups and treatment. Common concerns include fears of needles, discomfort during exams, uncertainty over what will happen, and negative past experiences. As a parent, there are things you can do to make doctor visits more comfortable for your child. Prepare your child in advance. Explain in an age-appropriate way what will happen at the appointment. Be honest without dwelling on frightening details. Practice deep breaths together to cope with any needles. Bring a favorite toy or activity for your child to have for comfort and distraction. The more your child knows to expect, the less anxiety-provoking the unknown will be. Involve your child in the process. Allow them to choose which doctor to see from pictures or summaries when possible. Let your child ask questions about the appointment and voice any fears or concerns. The more involved your child feels, the greater sense of control they may have during the actual visit. Make your child a partner in taking charge of their own health. Bring treats and rewards. Offer to take your child out for ice cream or let them pick a small toy after the appointment. Having a concrete incentive can provide motivation to get through any unpleasant parts. Keep the reward small but immediate to maximize its effectiveness. Remain calm and positive yourself. Your child will take emotional cues from you, so try to keep an even tone and remain upbeat. Explain that it may be uncomfortable at times but very important to keep your child healthy. Frame the doctor as a helpful ally, not a scary authority figure. If you seem relaxed, your child is more likely to be as well. Distract your child during exams. Tell a story, sing songs together, or let your child pick the music to listen to. Anything that engages their mind and imagination can redirect attention away from any discomfort. Keeping your child engaged in a positive activity they enjoy can make even routine exams go much smoother. Praise your child's coping skills. After each successful checkup or procedure, specifically acknowledge how well your child did. Tell them you're proud of them for being so brave and cooperating with the doctor. Positive reinforcement strengthens desired behaviors and encourages children to view themselves as capable of handling difficulties. Allow your child to set physical boundaries. Explain they are always in charge of deciding what the doctor is allowed to do with their body. Comfortable physical contact starts with consent. If your child says no to anything, stand by them and tell the doctor, "We'll have to skip that part today." Respecting your child's bodily autonomy helps them feel an increased sense of control. Leave immediately after checkups. Resist the urge to linger and chat with the doctor or nurse. Leaving as quickly as possible gives you a chance to provide comfort, distractions, and rewards while the appointment is still fresh. The sooner you can shift your child's focus elsewhere, the faster negative associations with the doctor's office may fade. Expose your child to regular medical procedures. Getting weighed. Having temperature taken and checking ears/throats at home on a schedule helps familiarize your child with what happens at the doctor. The more routine these procedures feel, the less overwhelming checkups are likely to be. With patience and gentle exposure over time, what once seemed frightening can become just another normal part of life. With consistency, open communication, respect for your child's autonomy, and plenty of preparation, patience, and praise, you can make even the most dreaded doctor visits a more positive experience for your child. Remember, just because checkups and treatment are necessary doesn't mean they can't also be infused with elements that bring your child comfort, distraction, and joy. With enough creative problem solving on your part and care on the doctor's, you may be surprised at how much progress is possible in transforming your child's relationship with that one sphere. Inducing place, the doctor's office. Write a paragraph in English with a length of 2,000 words on the topic "How do children not like going to the doctor?" For many children, going to the doctor can be a scary and anxiety-inducing experience. There are several reasons why children may not like going to the doctor. Firstly, children may be afraid of needles and other medical procedures. Shots, blood tests, and other procedures can be painful and uncomfortable for children, and may lead to anxiety and fear of going to the doctor.